Well, it's mixed. I think in the longer run there will be more opportunities, because the whole idea is to have what they call a mixed economy on the supply side. So the NHS is sort of a franchise, and people come in and they're regulated and monitored and so on and so forth. But I think that that is further away than the original policy intention. I think it's come at a really bad time for the NHS, where it's got to save £20 billion by 2015. There's a certain amount of, perhaps chaos is too strong a word, but certainly organisational disruption going on. And I think, you know, for a private provider to come in and even find out who to talk to is going to be difficult. So in the long run, I would think probably yes. In the short to medium term, it'll be difficult to make those connections. Well, moving public health to local authorities has been hugely controversial. The public health people themselves aren't keen on the idea, and it is based on the notion that public health is derived more from the way we live our lives and how we live our lives, have we got a job and what kind of education we've got, than it is anything else. And that's probably true, but the extent to which local authorities can influence these things is in my view, minimal. And I think we should move more now into the kind of data that supermarkets have. I mean, you know, they know when we go shopping, they know what we buy, they know where we live. You can really focus down on communities now and try and change habits and so on. But I think the other key thing for me about public health is that the big changes in public health have always happened as a result of a change in the law. If you think about it, you know, clean water, adult literacy, immunisation, and then we had seat belts in cars and crash helmets on motorbikes, health and safety legislation, and the big one, of course, was with the prevention of smoking in the workplace. So all of those things are the law, and it's very hard really to see any good results from where we just kind of nudge people to do things. When we nudge people, for heaven's sake, for years to give up smoking, but the moment the law came in, the amount of smoking went down, the cardiovascular disease went down. So I guess the jury's out. Well, the political winners will certainly be the coalition, who banged the table in the cabinet, and they saw it as a big victory. I think GPs will regard themselves as being the winners, in as much as they now have a fabulous opportunity to really influence healthcare, what healthcare we get and how we get it and so on. They might be the winners. But at the end of the day, none of that will matter unless the patients are the winners, and we won't know for some time.